Hey guys, welcome back to Medical Coding with Blue. Today is Q&A Tuesday. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Every week I take some of the questions that have been asked by viewer comments through emails or for Instagram, and I roll it all into one episode to bring you guys the #1 question and answer show about medical coding airing on Tuesday. So if you would like to have your question answered for a future episode of Q&A Tuesday, comment below or send me an email. I will include my email address in the description box below. So, thank you to everybody who submitted their question. Let's get started. All right, first question. Hi, I'm going to start my class this year, but would like to start reading and practicing in advance. If I want to practice some tests, should I just buy the complete official code book ICD-10-CM 2021? My advice is no, only because of the simple fact that if you want to get ahead, you need to start laying that good foundation first before you start touching the code book. The thing with learning coding is we have rules. So if you really truly want to get ahead, then you can start by reading the coding guidelines. And I recommend to read them once per week. And you don't even have to buy the book for that yet. So I will leave the link for the coding guidelines in the description box below. And they're free. You can reference them all you want. I recommend reading them once per week. And if it is too much for you to do in one sitting, it's totally fine. You can break it up into manageable chunks because I think it's 100+ pages, the online version. The one in the book is like 60+ pages because it's the font size and, that kind of thing. So if you are going to read it, just break it down into like 10 pages at a time, but make sure you space it out over a week, and that way you can just start again. The key to success in education as a medical coder is repetition. So if you are already getting a jump on understanding the guidelines or just reading them, because it's not going to make sense to you right away. I will tell you guys that. Because it's so much and it's so weird how it's worded sometimes. So I would just keep reading it. Even though you don't understand, just keep reading through it, because if you get hung up on, well, I don't understand what this is saying, eventually it's going to make sense when you go through your program. Another thing that you can do if you want to get ahead is to practice on your medical terminology and anatomy and pathophysiology. There's plenty of books out there. I do leave the links of the ones that I recommend in the description box below. You do not have to click on these links. These are Amazon affiliate links. So I may get a commission if you click on the link, but you do not have to. That's why the title is there. So you can look up the book on your own if you want to. But those links are in the description box below. That's a good way to start learning, because if you start trying to just dive in to the coding side and not really understanding your medical terminology, anatomy, and pathophysiology, it's not going to make sense when you can't find some of these codes. Yes, you may be able to find some codes, but if you start to come across like those combination codes, or there's other things that are going on and you haven't read the rules yet, you're going to get really frustrated because it's like it's not going to make sense. Like, why did I get this wrong? So that's why I'm telling you guys, start with your medical terminology, anatomy, and pathophysiology. Read the coding guidelines. So that way you can set a good foundation for yourself moving forward. That's just my advice. Next question. Hi, Blue. Can you talk about report quotas to complete in a day, and what is reasonable for your specialty and others that pay per report? So I don't know about pay per report. I know that there's some contract coders that do that. I don't know about what that costs or anything like that. As far as like the quota per day, I have seen the lowest be 80 per day, all the way up to 150 encounters per day in the outpatient side. Now, usually if it's in the higher range, it is because the encounters may be repetitive. So that may be why they're so high like that. And there's not a whole lot going on. So that's why you may have that. And it's usually an average per day. So if you're not able to hit, like if your quota is 90 per day and you're not able to hit it because you're running into like a very complicated, complex chart, and maybe you came up with 80 per that day, the next day if you hit 100, then you hit your average anyway of 90 per day. So it's usually just taken over time. and however long the range is, maybe it's like a couple weeks or maybe it's like a month, and they'll average out what you're doing, per day. So as long as you're trying to meet your quota and understand that there's going to be some days that you're not going to be able to make it because other things is going on, or maybe the chart is complex. So that said, as long as you're trying your best and you let your supervisor or your manager know, hey, this one is really complex, but let it be complex. Don't let it be because you're frustrated and you can't figure it out. If you can't figure it out, then you need to ask questions. There's a difference there. So I I used to work for a level 1 trauma hospital, so I would code for a lot of like traumas. And because of this, there was like lots of like accidents and things like that. These took time. So I had a legitimate reason when I went to my manager and I said, this one was really bad. And she's like, okay, I got you, Blue. That one was really bad. So there's reasonable situations like those when you can't meet it. But that is why you have to have really good communication and let your manager know. But yeah, between 80 and 150 in the outpatient side. On the inpatient side, you may see the numbers slightly or drastically lower because they usually average 2 to 3 per hour. And the reason that it's low like that is because these are, on the inpatient side, these are people who have stayed in the hospital, so they've been there for a few days. And you have to take the whole chart into consideration, everything, and you have to look at their entire stay. Some people are in the hospital for 5 days, some are in the hospital for 20 days. So it really all depends on what's happening with that particular patient and how complex their case is. So I mean, either way, you're still having to work and really concentrate, whether you are on the inpatient side or on the outpatient side. Okay. And I'm going to combine a couple of these because a couple of people are asking about the CBCS. And the CBCS, if you don't know, is a Certified Billing and Coding Specialist. And that is a certificate offered with the NHA, National Health Career Association. And I think I said that right. And so the thing with this CBCS, it is a billing certificate. You do not have to be certified to be a medical biller. You can just apply to be a medical biller. Most times they're going to ask you to either have some experience like working in an office, or if you don't, then, if you have experience being a biller, that's great. And sometimes they will say in the listing, we will train. And most times they will train because different offices do their stuff differently, but it all goes into the billing side of the house. So there's no certification needed for this. I just want to make that clear. When employers are looking for credentialed medical coders, they are looking for AHIMA, the American Health Information Management Association, and the American Academy of Professional Coders, AAPC, credentials. They are looking for candidates who have those credentials only. I have yet to see any employers asking for the CBCS credential to be a medical coder. So I have done job listing reviews before, and every single time they're asking for AHIMA or AAPC credentials. The thing with the CBCS is that, yes, some people have taken this and they have it on their name and things like that. People know in the industry what the CBCS is, that it's for billing. And again, when you're taking the CBCS exam, there are no books that are required to take this exam. So people have asked me before, Blue, I want to be a coder. Can I be a coder with the CBCS? No, because when you're taking the CBCS certification test, there's no books involved. When you are trying to be a medical coder, you have to have your books. And that is what we're being tested on, is our use of these manuals, the ICD-10-CM manual, the CPT manual, the HCPCS or HCPCS manual. And then if you're getting tested for the inpatient side of the house, then you have the ICD-10 PCS manual. So these are the manuals that you have to be familiar with and know. If somebody has a CBCS, that again, you don't have to be certified to be a biller. So if you're interested in just the billing, then try to start applying for these billing positions. So, but that's what I want to mention here. And the two letters were, the community college is only offering CBCS, CPC, and CCA. Which course would you pick if you had a choice? I am 58 years young and trying to do my research as thoroughly as possible. And the other one, it says, the program that I am taking is prepping me for the CBCS exam and for the CPC and CCA exam. I wanted to know if there are any employment benefits just for having the CBCS, or should I also go for the CPC and CCA? So again, when employers are looking for coders, they're looking for AHIMA or AAPC credentials. As far as getting the CPC and the CCA, you only need to start with one. And I always recommend starting with one because adding on a bunch of credentials when you don't have experience is not going to help you get a job faster or help you to make more money, because they want you to have experience to go along with those credentials. And when you're racking up these other credentials, you have to keep in mind that you have to be able to maintain these with continuing education units. Every credential has a continuing education units that they have to have in order to maintain this credential. It's not like you just test, you get your credential and you're good for life. No. This credential is a living document, basically. It is a living credential, I should say, because it still needs for you to be able to continue on in your education. We are in an intellectual field as medical coders, so we have to make sure that we're being trained on the latest. And because of that, that's why we have to have the CEUs. So I would recommend starting off with one. Get your experience with just one credential. And then when you are ready to move on and to go into higher positions, look and see what it is that your employer needs. And not only that, sometimes you can get lucky and your employer will pay for the additional credentials and schooling. So that's what you want. You don't want to have to go out of pocket for all of this and have such a high investment when it's waiting for you with your employer once you get in. So that is just my advice on that. But if you want to be a medical coder, you have to be certified with AHIMA or AAPC. All right, so I'm going to wrap that one up. The next question is, what is the difference between the CPC and the CCS? So the CPC is a certified professional coder offered with AAPC. And the CCS is the gold standard of medical coding credentials because this one credential says that you can code both inpatient and outpatient. There is no other credential like this one. If you're looking for on the job listings for medical coders, you will see that the vast majority of employers are asking for the CCS. So here's the thing. The difference is the CCS is inpatient and outpatient coding. That means you know how to use the CPT book and the ICD-10 PCS book. The CPC is just on the outpatient side. So theirs is covering the CPT. Like they know how to use the CPT manual. So that is basically what the difference is. One credential codes both inpatient and outpatient, or knows how, and one knows how to code for the outpatient side. Okay, so next question. Do you need a degree for medical billing only? No. Like I said, you just have to apply. So next question. Hi, Blue. Do you think that it would be beneficial to be a member of AAPC and AHIMA? No, you just need to pick one. Because, and usually, preferably, it is the association that you are credentialed through. Because there's really no sense in being members of both unless you're certified with both and you wanted to do that. But it's a little bit of like a lot, you know what I mean? So I would just recommend only getting membership with the one association that you are credentialed through. Okay. And then the next question. I start school in 3 months. Which books would you recommend to purchase for now? So because sometimes in these medical billing and coding programs, they provide you with books, I would recommend just getting like a deck of flashcards for anatomy, medical dictionary. You can get that. You can get a Merck manual, and I will leave the link for the one that I recommend in the description box below as well. There's a lot of extra supplemental books, but you don't want to overwhelm yourself. So that's why I say to just go ahead and start with like the flashcards. And again, all the ones that I recommend are Amazon links. You don't have to click on, but the titles are there, so you can check them in the description box right below this video. So, but yeah, just like the flashcards and a medical dictionary if you wanted to start looking at those beforehand. And again, if you wanted to read the coding guidelines, I will leave that link in the description box below, so that way you can check that out. So, do I have... Oh, okay. Hey, Blue, you gave lots of really good information and courage to learn more. Love this topic. Please share more tips. A big thank you. I am done with medical billing and coding from college. What will be my next step to get your certification? So when you go through these programs in college, they have some that are where they give you a diploma for finishing the medical billing and coding program that they have. But this isn't enough to get you a job. You have to be certified. So that would be your next step. And typically, the college will tell you who they're preparing you to take your certification exam through. So that is what I would recommend to do next. And go to both association websites, check them out, and see which one you would feel more comfortable with. Both associations are highly regarded in the industry, so you have your choice, you know. But both of them are very good, and like I said, they're highly regarded. So I would check and see which one makes more sense for you, which one that you feel most comfortable with. Get on the customer service hotlines for both of these places and ask questions. I get so many questions about the specifics of the association, particularly with AAPC, more than I do with AHIMA. And I'm not a member of AAPC. I'm not even credentialed with them at all. So I recommend that if you have specific questions about AAPC, that you go directly to their website. They have a wonderful little pop-up box that comes on there. How can we help you? How can we help you? They are very excited to help the people. So I would recommend that if that is what you are interested in. So, or if you're curious about it. Okay. Let's see. I still have time. I got a couple more minutes. Hey, I'm really considering medical coding, but I'm curious to know, is my iPad Pro good for the job? So when you are doing medical coding, and especially if they're sending you home right now because of the pandemic, to do this, they are typically going to provide you with a computer. If not, they will let you know. But most times you're going to get a computer from wherever you're working. They will provide you with one. So I wouldn't know about that iPad Pro. The next question. I'm interested in a career change, but I have visible tattoos, nothing offensive, all cultural tattoos. Do you think employers will be turned off? Just curious before I make that jump. Thank you in advance. So nowadays, employers are very progressive when it comes to tattoos. It's not frowned upon like it was back in the day. As long as you can kind of cover them up, that's just fine. But anything like really loud, you know, you may want to just cover up somehow. But other than that, no. I mean, coders have tattoos at my job all the time. So it's not anything that's bad or anything like that. So that's what I have to say about that. As long as you are well dressed. And I always talk about being well dressed, especially in the workplace. There are some times when people think that it's okay to wear like jeans and a t-shirt when you're going to work. That may be fine for some professions and for some jobs. That's fine. But for being a medical coder, if you're having to be around in the facility and you're around these doctors, it's important to put forth a good image. And when you do things like that, it promotes trust. It promotes like, okay, this person is here for business and I can respect this person. Not that if you're just dressed whatever, you won't get respect. That's not true. It's not what I'm saying. What I'm saying is that you want them to look at you like, okay, this person is being professional. Let me go ahead and work with this person, because I have seen it more than once, and I have seen providers who will gravitate towards people who are well dressed, and that's why I'm always insisting all the time on being well dressed, because of that very reason. And so it's something that when you are working in these types of positions, you will learn this stuff over time. And some people are like, well, I want to be comfortable. You can still be comfortable and still be professionally dressed at the same time. Okay. And if you're brand new and you're just starting out in Bleu, I don't have a lot of money. There's always like discount stores, and that's where I went to when I started. So, because I didn't have money either, I didn't have anything. I had been working minimum wage jobs myself, so you know, it just took time. And then over time, when you are like working, then you can start building your collection and your wardrobe because it is important. And even if you're at home, because like a lot of new coders are starting off at home. It's important for your own sanity to continue to get up and get dressed like you normally would if you're going to the office, even if you're going to be at home and no one is going to see you. It's so important because when the pandemic started and they sent all of us home, I had to do that because it was so important for me in my mental state to get into like working and things like that, to actually get up and get dressed like I was going to go to the office, because it helped me to be able to focus. And like my brain is like, okay, we've gotten up, we've done our makeup, we're all dressed up, and we're sitting right here at the computer to work. So that is a very important part. It may seem like it's a small thing, especially when you're at home and like, who's going to see you? Why do you take the time to do this? It's more important for consistency for you to do that, and that way you can stay used to it. And I hear a lot of my coworkers, they're just so happy because they say, well, I don't have to get up. I mean, it's like get dressed and I don't have to put my makeup on and I don't have to do anything, and I can just roll out of bed and get to the computer. And it may work for some people that way, but again, everybody's different, and this is just what I would recommend. So I'm going to go ahead and wrap this one up. I thank you guys for joining me. I hope you've enjoyed this episode, and I hope it has answered all of your questions. And this video has helped you. I hope that you will share it, and I hope that y'all will turn in next time. So I will wrap this one up. If you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider, or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye.